Hello, Amy here with San Antonio Cosmetic Surgery, Dr. Ortegon and Dr. Baumholt's practice. Today we're going to be featuring laser hair removal, and this is Genevieve. She's going to be our model today. We'll be doing her underarms. This is the Cutera laser. We will be using the YAG 1064. That laser is ideal for all skin types, from dark all the way to the lightest skin type, okay? That laser is ideal because it bypasses the color and the surface of the skin. It goes into that second layer. It is attracted to the hair follicle, absorbs into it, and it destroys it, burns it, damages it, hence trying to get rid of the hair. Okay? Usually our cycle of getting hair, what we're trying to do is kill the hair follicles so that it does not grow back. And so that takes usually about 6 treatments, depending on the ethnicity of the person, the hair type, the thickness, the area that we're treating, just so many different factors. So everyone is a little different, from 6 to 12 treatments. Sometimes the face will take a little more than the body will, okay, due to hormones and different reasons such as hormones, medications, genetics, etc.
We have a question. Does the hair follicle need to be dark?
Yes, the hair follicle does need to be dark. The laser, most lasers are made to be attracted to pigment, and so that's how it finds that hair follicle. So we do need it to be at least light brown to black. Okay. So when it's blonde or white, you're probably not, or even red, you're probably not going to get the best results. Okay.
Can it be done in any area?
Yes, from head to toe. I've literally treated a gentleman's head. We can do it up and around the eyebrows. Today we will be treating her underarm. So if you look at the underarm here, she's pretty much cleanly shaved. Okay. And what I'm going to be doing is putting a clear ultrasound gel. The gel is a conductor. It helps transfer the heat of that energy of our YAG laser, helps transfer that heat through the skin without burning the skin, without her feeling so much heat. Okay, so that's what that does. It just protects the skin.
Is there any preparation that needs to be done before a laser treatment?
Yes, you would. The best thing to do is gently wash the area. Have it nice and clean, no deodorant or any kind of skincare products, depending on the area that we're treating. And you want to probably shave about 24 hours to 12 hours prior to treatment. That way the skin is not too sensitive, you don't have any kind of razor burn, and you get the best treatment. You want it to have no hair because you want to burn the root of the hair and not the hair on the surface. Remember, the laser is looking for that pigment. So if the hair is on the surface, it's going to burn the hair on the surface instead of the root. What we want to do is make sure to kill the hair follicle.
Is there any swelling or irritations to be expected?
Depending on each person, everyone's a little different. I'm the kind of person where I wash my face and it's pink. So there are some people that during the treatment or even slightly after the treatment, you will notice their skin a little pink, but that usually goes away within, for most people about 20 minutes. There are some people that have really thick hair follicles, and the redness or little pink bumps will continue to show up to the next day, but usually goes away pretty easily.
How are you feeling, Gigi?
Pretty good.
Any discomfort?
No, just a little bit tingly, but it's not as bad as I thought it would be.
And it is a perfect timing to start doing it now when it's the winter time, right, Amy?
Yes, the best time to do laser hair removal is when you're going to be out of the sun for a few months. You want to be able to be consistent with your treatments. It's about every 6 weeks that you'll come and get your underarms done, every 4 weeks for the face. And you definitely want to be aware of any kind of sun exposure, because the sun and laser can really risk leaving you a 2nd to 3rd degree burn. So you really want to stay out of the sun while getting laser hair removal treatments or keeping the area covered. So your legs and arms, face, your whole body is ideal to do towards If you stay out of the sun towards the cooler months, then that would be ideal time to get it done. So you want about 6 months, 6 to 10 months to be able to do different treatments. So I'm going to move the laser over a little bit.
While Amy's doing that, just want to remind everybody that one thing, December 7th, our Christmas event, we're going to be doing for our Patient Appreciation Day. We're going to be having, hi everyone, we're going to be having our Patient Appreciation event on December the 7th. We'll have food, drinks, we'll have some drawings. We'll have again some live participation from our patients, probably Botox, Juvederm, which I love to do. Call us, 210-614-4320. Make your reservations. We will have a couple of drawings, so everyone come in excited to have some giveaways, like always. And our food is always fabulous, so don't forget, again, 210-614-4320. Amy, here we go again on the other side.
Thank you, Cynthia.
No problem.
Yes, so again, I'll remind you that the gel is a conductor. It helps transfer that heat into that second layer of skin without hurting her, burning her, making the treatment a little more tolerable so that she doesn't feel the heat on her skin.
Also, the tip of this machine is cold, right, Amy?
Yes, so if this is called the Cool Glide. So if you look at that, this little area is very, very cold. It's almost like putting an ice pack on the skin. So I place it down, and right away the first thing that she feels is a cooling sensation, and as that energy absorbs into that hair follicle, it is a very, I like to call it a little bite. It's a quick little warmth that you feel. It feels like a warm little poke. And every area is a little different. From what I know, right in the middle, so if you start here, like right there in the crease of the underarm is usually the most sensitive, where you have the most nerve endings, and you see that smoke, that is success right there. We are burning that hair follicle. And
if you see the smoke, don't be afraid. Gigi, how do you feel? Any pain, discomfort?
No, just a little poke, but like she said, and definitely that cooling helps. Tip.
It's an added plus. A lot of places people will say, God, it hurts, it stings, it bites a little bit. Having that cool head really helps the patient just go through this procedure. Even in the other sensitive areas, in the private areas for patients that are getting ready for spring break, it's a perfect timing to come in, have that bikini area, leg area, that way you're ready for spring break.
exactly.
Good to go.
Yes, yes. This is the perfect time to begin your laser hair removal because you do need a few treatments before you start seeing that hair reduction. With about 6 treatments, you're going to get about 85% reduction. That is pretty significant. When we're talking about your body's natural reaction and, your body's natural reaction, anytime we cut or burn ourselves, and what we're doing here is burning a hair follicle, your body's natural reaction is to try to heal that damage that's been done. So you want to find a good time where you can be consistent with your treatments and come in consistently in the cycle that it needs to be done. Usually your head is about every 4 weeks, torso about every 6 weeks, and then from your hips down about every 8 weeks is when you would come in for your treatments. So you want to be very consistent to really get that result. And like I said, 85% is pretty significant reduction for hair. There's no such thing as 100% reduction, but we can get pretty darn close to it. So how are you feeling, Miss Gigi?
Pretty good. Like
Yeah?
nothing.
Nothing?
Like that.
And if you see that there's no pink, there's very, very little pinkness, but there's no bumps, no irritation. Sometimes when we are doing very thick hair on the like beard area, sometimes even thicker areas, bikini line, things like that, you will see a few little bumps. They look like little ant bites, but like I said, they usually subside within 20-30 minutes. And we can always use ice packs to help calm and soothe that area. And I do adjust the settings according to your skin type and your tolerance and your comfort level, things like that. So
Is it something that's permanent, and how many treatments does it take?
we never say the word permanent because we have active hairs and dormant hairs. So when you're in your 20s, you come get your laser hair removal for your upper lip and your chin, and everything goes away and it looks great. But by the time we're in our 40s, our hormones have changed. different things that go through our, happen in our body, our genetics, our everything, play a factor in that. So you could get some of that hair back, and it's not necessarily the same actual hair, but it can be a little bit in different areas. So do we guarantee 100% hair removal? No, it is hair reduction. So I would usually count about 85%, 75 to 85% reduction with at least 6 treatments. Sometimes some of us need more. And so with that being said, if you want to come in and get your complimentary consultation, I can go over, just depending on, like I said, your skin type and the area that we're treating, how dense the hair is, and we go from there, and I can give you price quotes and everything. Don't forget to give us a call. Don't forget about our event on the 7th. It's after work from 5 to 8. Our number here is 210-614-4320. My name is Amy, and this is Cynthia, our nurse. I'm the clinical esthetician here, so if you guys have any questions, either one of us can answer that when it has to do with laser hair removal or any kind of injectables or anything like that.
And don't forget to like us
Yes.
on Facebook. Ask your questions. We'll do our drawings tomorrow. We'll have a $200 gift certificate to our spa services. So that's always fun for our patients and our viewers. Tomorrow we'll do that again around 12:15. And again, our event on December the 7th. Okay? Thank you so much for watching.
Hope to see you soon.
Bye.